It's very easy to see how an injury to L5S1 can progress into an injury of L4-5 and L5S1. It's very easy to see how we can perhaps re-herniate the disc we thought was fixed, how we can re-injure the segments above or below the herniated disc that was intervened with from a microdiscectomy. We can see how these sorts of things happen. And so really we want to say, okay, how do I actually go about avoiding those sorts of things happen going forwards? The most important thing to understand is that unlike an injury to the knee or the ankle, with back pain, we have that education. It needs to be in place because we can't put those things in a cast or the back in a cast like we can with those other injuries and prevent you from messing them up on a daily basis for 6, 8, 12 weeks. We have to acknowledge that you have to deal with your back every single day. So a good amount of education is really important in the early days and ongoing. We need to understand that we need to start from a point of spinal stability rather than this fruitless and endless mobility exercises with things like cat's cow, child's pose, knee hugs, rocking, bending one way or other because your spine is feeling stiff. Of course, the thing is not feeling very good. It's injured and we need to focus on stability. Exercises like the Core 5 for spine health, which were covered in a recent podcast, focus on you actually learning to stabilize and protect these segments on a daily basis with simple movements that are true to real life. Movements like the squat, the hip hinge, and the step up are movements that you will be doing regardless of whether you've had surgery or not and whether you've had surgery a week ago or 6 months ago. You will be doing those movements every single day. We can either roll the dice and hope for the best and maybe they'll flare up and maybe they won't, or we can start to learn how to perform them, maintaining a neutral spine through the entirety of range of motion and starting to understand when we are losing appropriate composure and stopping before that point, before the point at which the back goes like that and creates trouble.